Well, Richard, healthcare is certainly coming front and center, and so tell me what you're hearing in the district and what you believe, what your position would be going to Washington regarding healthcare.
Well, I do think that the government should be out there trying to make sure that everybody has affordable care and access to affordable health care throughout the country. And I do think that there are things that we all agree on as far as portability of policies, as far as covering pre-existing conditions, and as far as keeping kids on health care policies as is done right now. Those are all things we have in Massachusetts already as part of the Massachusetts law. And we've done pretty well in Massachusetts, and the question is, how do you extend those benefits out to other states? When we passed our bill here in Massachusetts, we had 92% of the people who were insured, so our goal was to get from 92 to 100, and we've pretty much done that. But not every state is like Massachusetts. You have some states with 20 or 30% of the people who are uninsured. So I think rather than having a one-size-fits-all approach, where the federal government imposes a system on all the states, that really what they should be doing is incentivizing every state to figure out ways and come up with innovative programs to get more people insured, and and financially help those states who do that. And I think that would be a better approach than having this mammoth law take effect, because as I'm all over the district right now, I'm meeting with a lot of small business owners, medium-sized, large, and they all tell me the same thing, is that they're not going to hire anybody right now until they see how the new law shakes out. And we have so many people who are unemployed, underemployed, and jobs aren't being created, and this is one of the reasons why. So I do think that the smart thing to do would be to repeal the bill and have a bunch of reasonable people sit down who aren't going to be in a partisan food fight and put together a bill that does the things that people want and makes insurance more accessible for people.